goes into effect today at 1 p.m. Really, the one that has got the most headlines there's a statewide mask mandate. We've had in 23 counties mask mandates previous to this, covering about 90% of the population of the state of Utah. But we did think that there was a little confusion out there as far as who was in, who was out. And so because of the crisis that we're facing here right now today, we decided to make that mask mandate just statewide. Again, the motivation behind that is because of the case numbers, but mostly because of the overcrowding of our hospitals. They are really at the brink of not being able to take any more people and the overflow mode, particularly in our intensive care units. And it's not that we don't have rooms with 4 walls, we just don't have rooms that have got doctors and nurses that can provide the health care in those rooms. And it's to the point where we're now having to turn away people coming to our state from Nevada, turning away people who have been coming to our state from Idaho, Montana. We, in fact, have been turned away from going to Colorado Springs from the Four Corners area to their hospitals there because they have the same problem. So it's an issue that we see around the state with overcrowding of our hospital units, and particular intensive care units, and the lack of staffing capability. So that's motivated us, and so the face masks as a statewide mandate. Also to not gather socially. We find that our highest infection rates are now coming from when we get together, not in structured events where people are in fact are following protocol of masks and social distancing, etc. It's coming from these casual gatherings where we get together with family and friends, and probably our guard goes down, we're a little more complacent. We don't follow those kinds of protocols and take the precautions that are necessary. And last but not least, putting a pause on extracurricular activities, particularly in our schools and our high schools, and for the next 2 weeks. Again, I think it bears repeating, we mentioned it last night, but our highest infection rates are between the 15 and 24-year-olds, our young people. I know they have a desire to get together and socialize, and sometimes in their zeal to do that, they forget the precautions they should be taking. Again, this appears to be a disease which we're learning more about as we go. Certainly our medical professionals are learning how to treat it better than we've had before, so that leads to shorter hospital stays and less death. But nevertheless, young people don't have quite the severe reaction that as you get older that you do. And so they probably don't notice it as much and probably feel like it's not impacting them. But they tend to be vectors of transmission. And so they transmit that infection to others who may be more vulnerable and more likely to have a severe reaction, and certainly those that in fact have it and then die. So we've got to concentrate on that area as an area of focus, and that has to do with our young people. We're also going to be doing more testing. And we can talk about that maybe in part of the question and answer part of this today media event. But testing needs to be accelerated. It's been an issue for us from the very beginning. We wanted to have more testing. It would be ideal if we could just test everybody and see exactly who's got it and who doesn't. Those that haven't, we'd isolate, and we could certainly stem and slow the spread, if not stop the spread. If we could do that. We haven't been able to do that. We don't have enough tests, at least in the past. But we're going to accelerate the testing program today to, in fact, include our college students. They should be tested once a week. Our professors and teachers and faculty in college also. We certainly want to test students that are involved in extracurricular activities in high school. We like to make sure that the teachers get tested at least once a week. And there are opportunities for them to get PCR tests through our Test Utah program for all of our teachers currently. We want to accelerate that. We have new testing opportunities out there that are more rapid. We have testing programs through Abbott Industries that now we can do in about 20 to 25 minutes total from the time you walk in until you get the results. That's going to help us, in fact, find out who's got it and do it in a more convenient, less invasive manner. So again, we're in a good place, I believe, particularly if everybody, in fact, works together As I mentioned last night, I'll reiterate it again here this morning, this is less about government mandates and us telling you what to do. It's more about taking personal responsibility. But both of those working together, we believe will help us to change and modify our behavior so that we have a better outcome. And that's really the motivation here. We want to slow the infection, and we want to make sure that our health care is being taken care of. At the same time, making sure our economy continues to function. Striking that appropriate balance is our goal. So with that, we'll open up for some questions for me and Dr. Dunn.
Hi, Governor Herbert. This is Sophia Eppolito with the Associated Press. I was wondering, this is our first COVID briefing since we've elected a new president, President-elect Joe Biden. And I'm curious if you could share your response to Biden's emerging virus plans and how you think having this new administration may change your approach to fighting COVID-19.
I don't know what President-elect Biden's plan is on slowing this down. I know a lot of people have had ideas, and so I haven't had a chance to see what he's proposing to analyze it. We're just concentrating on what Utah is trying to do. All of us need to work together and see if there's a better way. We certainly have evolved as we've learned along the way as far as what protocols we should put in place. Maybe Dr. Dunn, would you like to talk about that? You know about that?
Yeah, hi, good morning. I mean, similar to Governor Herbert, I haven't read through all President-elect Biden's plans. I do know there is a focus on more of a national standardization of, testing and the vaccine distribution and how we respond to outbreaks. So I think just continuously bringing together experts from across the nation to inform what we can do at the state level is going to be really important moving forward.
Let me just add too, I expect that the governors will be working through the National Governors Association to make sure that we have input from the 50 states and the 5 territories. Distribution of the vaccine really is a critical issue. It started under the Trump administration, making sure that we have plans in place. I think there's encouraging news out there for a vaccine. In the next few weeks or 2 or 3 months. I don't know exactly what. We've been told by CDC that maybe by the first part of December, at least the first wave of that distribution can happen. It would first go to those who are healthcare providers on the front lines to protect them. It would then go to those who are in long-term care centers, the vulnerable populations, those over 70. And hopefully over the next 2 or 3 months as it's rolled out, it will be as we ramp up the production, that it will be for general use for the population. That really is the game changer we're trying to get to. And I'm hopeful and optimistic. I saw an article in the media this morning about Pfizer finding 90% effective of their vaccine that they're testing in their clinical trials. So reason to be hopeful. Next question.
Sure, this is Michael Locklear with 2 News. I have a question for Dr. Dunn. I'm wondering of all the possible interventions that the state has considered, why these were the ones that were decided on. And is a 2-week pause on social gatherings and extracurriculars enough to put a dent in the current surge?
Sure. So in the process, we gathered information from across the nation and other countries as well, in addition to our own specific Utah data, to come up with the best public health recommendations to slow the spread. And, I really believe that if every Utahn adheres to the principles that were outlined by Governor Herbert, we will start to see a decrease in our cases. And we need that urgently. So it's up to all of us as individuals to really adhere to those principles to make sure that our healthcare systems can maintain the capacity to treat patients for both COVID and non-COVID issues.
And is a 2-week time frame enough time for that to happen?
I think it is definitely enough time for us to start to see the decrease in cases. Again, it's going to really depend on all of us adhering to these principles. And we'll watch the data to see what is needed past the 2 weeks.
And just a reminder that the 14 days really has to do with the incubation period of the coronavirus. And so we should see some results if we do what we're being asked to do. If people don't change their behavior, nothing will change. Next question.
Hi, Governor. It's Ben Winslow with Fox 13. Wanted to ask about why you decided to do this now. I mean, were you waiting for, say, after the election? And what do you do if you don't see a turnaround in COVID-19 cases?
Well, number one, let's not think negatively. Let's think positively that people, in fact, will gather together and unite in a common effort for the common good. Again, we are a community that's been very willing to sacrifice on behalf of our neighbors, those that we know and those that we don't know. We've seen that in times of adversity in the past, whether it be during the earthquake, during fires and floods, during the windstorm, hurricane strength. We've seen multiple times. People really do care about their neighbors and try to give a helping hand. This is the same kind of a thing. It's a little different, but I expect that people will respond in a positive way. That was the first part of the question. Why now? It has absolutely nothing to do with politics. I think it is, in fact, unfortunate that we've had this pandemic during a political year. I think that, unfortunately, the politics has gotten in the way of really doing the right thing in the right way as soon as we can and uniting the public. Politics has a way, unfortunately, of dividing us. And so I think the pandemic has been exploited by people on...
Hello, can you hear me? Hello, can you hear me?
Oh, okay, wait just a minute. Politics has a way of dividing us, and both sides of the aisle have, in fact, used this as a political tool and a message to advocate for their position. So a non-election year, I think we'd had a little better time of bringing people together, which is what we need to do. But we've been following the data, Ben. It's been, what have we learned from the data? It has been up, it's been down. We've done some really good things. We've tried to strike the balance. We've never wavered from that. We've talked in terms of not making decisions based on fear. I don't think we should fear the virus. I think we should respect the virus. And we've also said we're not going to make it a political statement. We're going to try to find the right policy based on the data and the information we have that is in the best interest of protecting the health and welfare of the people of Utah, as well as making sure the economy continues to function. Both are important. They should not be done in exclusion with each other. And that's the position we've taken in the beginning, 8 months ago. That's the position we've had all along. It's the position we have still here today. Next question.
Governor, hi. This is Sean Means of the Salt Lake Tribune.
Yes, Sean.
You've stressed that Utahns should see last night's order as a signal of how seriously we should all take COVID-19. But there's so many exemptions to this order. I mean, no gatherings, but it's okay for bars or movie theaters or large hosted events. Masks are critical everywhere, but it's okay not to wear a mask in churches. School activities need to stop, but football playoffs are okay. Do all these exemptions undermine your message about taking the virus seriously?
Well, I'll emphasize again, Sean, we're talking about trying to find the right balance point. It's not one at the exclusion of everything else, and we've tried to do that. It may not be perfect, but it's certainly an attempt to find the right balance point of making sure we do what we need to do to protect people's health, and yet allow people to still have their First Amendment rights of worship, not telling churches how to conduct themselves. I think that's inappropriate. Making sure that businesses can continue to function, we're still open for business with appropriate protocols in place. So again, I think we're fairly consistent in what we've tried to do and find the right balance point. I think what we've identified last night is exactly right. And it is a way that we can, in fact, slow the spread of the coronavirus. We are finding, again, that unfortunately, some of our young people are the ones that are in most violation, and our casual gatherings. So we're trying to identify those as what the data tells us and informs us to do is how we've created the policy. So again, we're trying to find the right balance to protect people's health, but also protect the economy as best we can in an appropriate and common sense way.
Okay. To follow up, especially with football playoffs, is that going to include fans in the stands? Because that would seem to be an opportunity for the virus to spread.
We have worked not only with our medical professionals, but with our high school activities and athletic association, which dictates, how these activities take place. The recommendation they've given, which we've put in, will be in the order, is that participants, say in football, each one of the participants can bring 2 fans to the stadium. So there'll be some restriction on the total number of fans that can participate. And again, the fans, in order for this activity to be put on, the football game to occur, they've got to have social distancing and masks, or they won't be allowed to have the game. So they're going to be a little bit more strict than they have in the past, and some reduction as far as attendance, but there's only about 12 games left to go, and we want that to be concluded. The others we're putting on a postponement for 2 weeks to see if we can get our testing protocols in place and see if we can allow other activities to happen this winter as we move back indoors and close quarters. Basketball comes to mind, volleyball, other things that might happen indoors, other activities, the theater, drama, music, band, those things we're going to take a close look at and put in place protocols after 2 weeks to make sure we have proper testing and oversight so those, we hope, can continue. Okay, next question.
Hi, this is Lauren Bennett with KSL.com. I have a question. With Pfizer's news about the vaccine, I'm wondering what Utah is doing to prepare for a vaccine and if there's a distribution plan in the works.
The answer is yes. I'll let Dr. Dunn elaborate.
So we as a Department of Health submitted our plan for vaccine distribution to the Centers for Disease Control and Prevention a few weeks ago. And that was based on, it's really hard to come up with a plan. We don't know how many doses you're going to get and what the efficacy of the vaccine really is. But what's really exciting, and Governor Herbert mentioned, is the increasing evidence that the Pfizer vaccine will be quite effective. So plans are in place, especially because this vaccine needs to be stored at very, very cold temperatures to get those freezers to as many healthcare systems and hospitals as we can so that we can actually take the vaccine and store it appropriately and then distribute it. So it's a plan that we've been working on for several months now, and it will continue to evolve as we get more information about the vaccine.
Next question.
Hi, this is Katie McKellar with Deseret News. Governor, why did you wait to issue these levels of restrictions even though the data said weeks ago a drastic change needed to happen to avoid hospitals being overwhelmed? Does it have anything to do with the legislature's ability to call itself into session and override your decision?
It has only to do with data. Again, this has been a work in progress since last March. We've had great success in the early days. People's behavior was better. I think being outdoors helped. We've wanted to have not the heavy hand of government, but the soft velvet touch of government, giving guidance and direction and letting people, in fact, make appropriate decisions. That's worked very well. As we started moving back indoors with schools coming in, we found that was not working as well. We've followed the data. We have had good communications and cooperation with the legislature. Every step of the way, we meet on a weekly basis and review the numbers and the data. It has really to do with the information we've received and trying to develop the best policy we can, which strikes that balance point that I've already talked about. So nothing to do with elections. It really doesn't have anything to do. I can call them into special session if I wanted to and needed to. That's maybe a possibility in the future. But it has nothing to do with their ability to call themselves into special session. If they wanted to do that, I don't know that they can on this particular instance. It has to be some kind of an emergency and financial crisis. I don't know that we have that in place right now. But we're working together. I talked to the Speaker and the President, so there's a significant spirit of cooperation and a united front in most all this. We don't agree on everything, and certainly there are people in the legislative body itself that don't agree. Some are more libertarian on this and would say the government shouldn't do anything. We think as a conservative, myself, the government should have a role to play and guide, and we certainly have had laws passed in the past that tell us about where you can smoke and where you can't smoke so you don't in fact, improve or increase health hazards for somebody else. We have smoking restrictions. We have restrictions as far as what you can do in traffic, the speed limits and road right-of-way signs, and we have seatbelt requirements to protect. You have to wear a seatbelt to protect yourself. So wearing the mask and some of the directions we're giving are very similar. And certainly this is a health situation, so our Department of Health, which has been empowered by the legislature, in fact, to make some of these decisions. We all know in restaurants, that there are certain protocols that they've got to follow or they'll be closed down. And that's before the pandemic hit. So Again, we're using the tools that we have in an appropriate way to find that right balance point to hopefully have us all take on individual responsibility, change our behavior so we can slow the pandemic down.
Yeah, hi, this is Haley Hendricks with ABC4 News. I have a two-part question for you guys. So first, can you talk about where you will get this surplus of testing for students? And is this reason that college students are being required testing and not K through 12 ages because they are minors, or does it have to do with the COVID-19 cases possibly being more present in college-age students versus younger kids and teens? And then I'll follow up with a second question after that.
So when Dr. Birx and Dr. Redfield came to Utah, it probably was a week and a half ago at this point, they assured us that if we used all of our rapid testing, that they would supply us with more. And they pushed us, as they did a lot of other states, to increase our rapid testing among university students in that setting particularly. It is certainly, as you alluded to, it is a little simpler to get it off the ground because the infrastructure is already in place in a lot of our universities. And we do know that that age group has been responsible for a lot of our cases and in the start of this surge that we're currently in. So we're going to start with them. In the meantime, we are working on plans for our K through 12 students, specifically starting with extracurricular activities to begin with. Because once again, our data is showing that students don't tend to be infected actually in the school setting, but rather in the extracurricular setting. And so we want to make sure that we can provide a safe environment for students to continuously engage in those extracurricular activities, and testing will be part of that, but starting with universities at first.
Okay, thank you. Now, can I get some clarification on private businesses? With private businesses having club sporting teams, if they are part of businesses that stay open, or if they too, along with school sports, need to follow this protocol of shutting down for the next 2 weeks.
So the question was about what impacts businesses?
So I think.
Yeah, so basically, is it
club
just
sport,
school
okay.
activities and sports, or does this include private businesses?
Yes. We've put a pause in place is really what we're referring to the next 2 weeks on a number of things, and extracurricular activities after school is one of those that's impacted. We don't want to necessarily stop them from happening. We just want them to stop for the next couple of weeks as we analyze our ability with the Utah High School Activities and Athletic Association as far as how can we in fact bring them back. Testing is going to be a key issue. I don't see any way that we'll have any kind of sport activities unless the athletes are able to be tested on a regular basis. We've seen what they've done with in professional sports with the NBA or NFL, Major League Baseball, with testing. That probably gives us some guidance as far as what can we do, a similar thing with our high school athletics. Intercollegiate sports are governed by their own conferences. They're getting testing now. So we're going to review that and see if we can put together a protocol that will allow these activities to resume after 2 weeks. But we need to have a pause on it until we can analyze all the pros and the cons and see what in fact can be done. So the intent is to find a way to go forward.
Okay, so I just want to clarify that, private businesses that own dance companies, cheer, anything like that, those also need to be put on pause because they are considered extracurricular, correct?
Private businesses have to follow the protocol, though, of social distancing at least 6 feet, as well as wearing of a mask if you can't do that. So if you have a commercial enterprise, any business, if you'll follow those protocols, you can still continue to participate. It's the schools after the casual activities and also the gatherings that we have at school that we're concerned about. We just need to make sure that there's protocols in place and we have testing capabilities to help that to happen. But if you have a private dance studio, if you've got 6 feet of distance with your people and mask wearing, you can continue to, in fact, do that. But that has to be adhered to. And again, we're very concerned that people are being casual about that, really not enforcing those restrictions.
Okay, thank you very much.
Thank you. I want to ask Dr. Dunn a question myself because the testing has come up, and this is a question all of you probably would like to know about. We have people that say, with additional testings, we're ramping these up. You know, we could get up to 20, 30,000 a day. And we have the ability with the federal help to do that. We are going to certainly make that an attempt. But we have people say, well, if you test more, you're going to find more cases. Find more cases, you're going to test more, and then you find more cases. It's as a spiral to just a more severe reaction. I'd like Dr. Dunn to talk about why testing more will help us, not just find more cases, but actually find less cases over time and slow the spread. So could you give us the medical advice there?
So currently our percent positivity is over 20%. That means that there are a lot of cases out there who don't even know they have COVID, and so they're out coming into close contact with other individuals and potentially spreading the virus. We need to identify everybody who has COVID-19 in order to stop the spread of it. So initially, when we roll out a lot of testing at once, we will likely find additional cases. But over the coming weeks and months, that will result in a decrease in spread and a decrease in cases, because individuals who have very mild symptoms or perhaps no symptoms at all will know their COVID status, and they will be able to isolate appropriately, preventing spread from additional individuals. So this is an essential piece in decreasing hospitalizations and decreasing deaths throughout our state.
Let me just add to that too, that this is an example of how we've learned as we've progressed. Originally, the CDC and others thought that people could not be infectious if you did not have symptoms. Now we're finding out over time that that's not true, that in fact you can have the viral load and infect other people even if you don't have any symptoms yourself. We call them asymptomatic people. So we're going to make a significant effort to test more people, even if they don't have symptoms, to see if we can isolate them and find out who's got it to help slow the spread. So again, that's an example of what we've learned over time that's different than what we started out with. Next question.
Hi, this is Mitchell Zavales from Telemundo. How would these measures be implemented, and who will ensure the standards is met?
So who's going to implement? We have two ways of enforcement. Most of it's going to happen at the local level. We certainly have the Department of Health, which has authority to in fact make these restrictions, as well as we have now an emergency declaration in the governor's office to help us. So we have both of those options to make sure that it's enforceable. That'll happen mostly at the local level, the local health departments and local law enforcement people. For our businesses, that we've asked them, in fact, to make sure that their employees are protected, that they have, in fact, social distancing and face mask requirements for their employees, as well as, in fact, have that as a requirement with signage as you come into the establishment of a retail outlet or restaurant, that masks are required, social distancing will be enforced. And if they don't do that, then the Labor Department actually can, in fact, fine them for lack of that, which would jeopardize their business license. So those enforcement mechanisms are there. Again, I know what the reality is. It's going to be hard to identify, and it's going to be hard to enforce, but it is enforceable, and we will probably see some of that happening. But again, I would just encourage everybody that it's not about government mandates as much as it is about personal responsibility. We all, as a society working together, should unite and do our part to do the right thing without having to have somebody come and say, we'll fine you if you don't do it. You should do it just because it's the right thing to do, as we've said from the very beginning. Now we've got a little more teeth in it, so maybe that'll help motivate people to be a little more consideration given to their fellow man. This is the last question.
Hi there, Governor. Can you hear me okay?
Yes.
All right. Thanks for having us. I've been talking with some restaurant owners specifically about the new mandates coming out, and they have a question of whether are restaurants and bars responsible for asking people if they're in the same immediate household when they come to their business, and also with the mask mandate, is the state going to be providing masks to businesses and schools?
The answer to the first question is no. That's a burden is placed upon the individuals themselves that come into the restaurant, and We've asked people to, in fact, for the next 2 weeks to sacrifice a bit and make sure that their associations with members of their own household and not outside that arena. And so that's an individual responsibility. It has nothing to do with the restaurant having to ask people to identify whether they're household members or not. I don't know of any program right now providing our restaurants with, in fact, mask requirements. I think a lot of businesses are, I'll say that differently. I don't know of any program out there that says we're going to reimburse or provide masks for our restaurateurs and business people to say, if you don't have a mask that you come in with, that we'll provide one for you. We find many businesses are already doing that. I grocery shop at Smith's, and if you don't have a mask on, you can't come in, and they will provide one for you if you need one. I think that's kind of what the market is doing anyway. We're just probably expanding that effort throughout the state. And so I don't know of any way, any plan to provide the mask for them. But I think it's good business. I can tell you that those who are doing that are finding people are coming back and shopping. They feel safe. They feel comfortable there. And in fact, I think that's just good business. Maybe a cost of overhead, but it's pretty minimal overall to get people to come back and shop. So I think it certainly has offset. That's something we can take a look at, but right now the businesses will need to expend the money if they provide the mask. They can always say, go get your mask and come back. We won't provide one for you, but I think that would be probably not good business practice. I have one last question for Dr. Dunn before we sign off here today, which has to do with a CDC report that I keep hearing about occasionally from people out there that says that the people think that we really aren't in a crisis situation. That certainly, if you talk to the hospitals, the medical professionals, the doctors out there, all of them are united, at least 95%, saying we are in a crisis mode. We have to change our behavior or we're going to have serious ramifications. But the CDC came out here a couple of months ago and said that as they identified deaths in America, they said that only 6% of the deaths are COVID-19 only deaths. Now, the overall deaths that that's been predicted for this year were about 300,000 higher than what we had predicted, and that's really the answer to that is COVID-19. And so I would like Dr. Dunn to talk about what is it about this statement from CDC that's factual and what's not true, so we can understand better the crisis that we're in.
So that statement, unfortunately, was a misinterpretation of the report that was issued by the Centers for Disease and Control. So what they are saying is that on death certificates, COVID-19 was listed only 6% of the time. We know from various other studies beyond COVID-19 that death certificates don't always do a great job of identifying the cause of death specifically related to a virus. So it might say, like they were unable to breathe and they died, or their heart stopped and they died. But it could have been due to COVID-19 because they did have the virus. So we're lucky in the state of Utah that we have an excellent office of our medical examiner that's staffed by forensic pathologists that are physicians, and they're able to certify deaths that we have any confusion over what actually caused the death, and they will investigate the deaths and make sure that COVID-19 was actually a cause of that individual's death. Regardless of what it says on the death certificate. Again, because there's several things that could be on that death certificate. So that statement that's been repeated over and over is really a misinterpretation of that. We have to recognize that as we identify more individuals, the number of people with COVID is going to increase. And in the short term, our case fatality rate, or those who pass away from COVID, is going to decrease because that's a delayed or lag indicator. And right now, the denominator, number of people that are infected, is increasing so rapidly that our case fatality rate will drop. But that doesn't minimize the impact that it's currently having on our hospitals when people are struggling to find ICU beds and provide adequate care. So the principles that have been laid out under this new order are essential to improving our situation. For the next 2 weeks, I urge you to only hang out with those who live in your household. So people that are under your roof and sleep in the same house. should be gathering for the next 2 weeks. This will be the start of us being able to save our healthcare system.
Thank you, Dr. Dunn. We appreciate the work of so many out here trying to help us get the right outcome. It really boils down to our own individual behavior. This is a time for us to reflect on what we've done in the past and what we can do going forward. A time to reset, a time to reevaluate, and for all of us to kind of unite together and change and modify our behavior. All of us can do something better than what we've been doing in the past. All of us look for opportunities to improve. And if we do that, we can, in fact, bend the curve and slow the spread of the coronavirus and make sure we continue to have a good, healthy economy, but protect people's health at the same time. Thank you very much.